1. Which of the following is the most important action for preventing the spread of infection in a hospital setting? Answer: hand hygiene. Explanation: hand hygiene is the most effective way to prevent the transmission of infectious agents, as it removes pathogens from hands before they come into contact with patients or surfaces. 2. What type of mask is required for healthcare workers caring for a patient with tuberculosis? Answer: N95 respirator. Explanation: an N95 respirator is necessary for airborne precautions, such as when caring for a patient with tuberculosis, as it filters out airborne particles. 3. What should a nurse do before applying sterile gloves to maintain a sterile environment? Answer: perform hand hygiene. Explanation: performing hand hygiene is essential to remove any potential contaminants before donning sterile gloves to maintain a sterile field. 4. When should a nurse wear gloves while caring for a patient? Answer: when handling bodily fluids or contaminated materials. Explanation: gloves should be worn when there is a risk of exposure to bodily fluids or contamination, which helps prevent the spread of infection. 5. What is the most important measure for preventing the spread of infection in patients with Clostridium difficile, C. diff? Answer: hand washing with soap and water. Explanation: alcohol-based hand sanitizers do not effectively kill C. diff spores, so hand washing with soap and water is the recommended method for infection control. 6. A nurse is preparing to clean a surface in a patient's room. Which of the following is the most important precaution to take? Answer: wear gloves. Explanation: wearing gloves prevents direct contact with potentially contaminated surfaces, thus reducing the risk of spreading infection. 7. A patient is placed in isolation precautions due to a suspected viral infection. Which personal protective equipment, PPE, should the nurse wear? Answer: mask and gloves. Explanation: for most viral infections, mask and gloves are required to prevent the spread of infectious particles through droplets or direct contact. 8. A nurse is assigned to care for a patient with a drug-resistant infection. What should be the nurse's priority action? Answer: follow contact precautions. Explanation: contact precautions help prevent the transmission of resistant organisms through direct or indirect contact with the patient or their environment. 9. Which of the following best describes the correct procedure for disposing of a needle after injection? Answer: place it in a puncture-resistant sharps container. Explanation: needles should always be disposed of in a puncture-resistant sharps container to prevent injury and infection. 10. What is the purpose of using a surgical mask during patient care? Answer: to prevent the transmission of respiratory droplets. Explanation: surgical masks help block respiratory droplets, reducing the risk of spreading infections through coughing, sneezing, or speaking. 11. What is the most effective method to prevent healthcare-associated infections, HAIs? Answer: proper hand hygiene. Explanation: regular and thorough hand washing or using hand sanitizer significantly reduces the transmission of pathogens and prevents the spread of infections in healthcare settings. 12. A nurse is caring for a patient with a draining wound. What type of precautions should the nurse use? Answer: contact precautions. Explanation: contact precautions are necessary to prevent the spread of microorganisms from the patient's wound to others through direct contact. 13. When should a nurse change gloves during patient care? Answer: after each patient contact or after handling contaminated materials. Explanation: gloves should be changed to prevent cross-contamination and protect both the nurse and patient from potential infection. 14. What type of precautions is required for a patient with measles? Answer: airborne precautions. Explanation: measles is transmitted via airborne particles, and airborne precautions, including the use of an N95 respirator, are necessary to prevent transmission. 15. A nurse is caring for a patient with a respiratory infection. Which PPE should be worn? Answer: surgical mask and gloves. Explanation: surgical masks prevent the spread of respiratory droplets, and gloves protect against contact with potentially contaminated surfaces or fluids. 16. What is the primary goal of infection control in healthcare settings? Answer: to prevent the spread of infectious diseases. Explanation: Infection control strategies aim to minimize the risk of healthcare-associated infections by reducing the transmission of infectious agents. 17. Which action is recommended to prevent the spread of infection when handling soiled linen? Answer. Place the linen in a laundry bag without shaking it. Explanation. Shaking soiled linen can release airborne pathogens. It should be placed in a sealed laundry bag to prevent contamination. 18. What should be done to prevent contamination when handling medication in a hospital? Answer. Follow proper hand hygiene before and after handling medications. Explanation. Hand hygiene helps prevent the spread of pathogens when handling medications, ensuring they are not contaminated before administration. 19. A nurse is cleaning a surface in the room of a patient with a multi-drug-resistant infection. Which disinfectant is most appropriate? Answer. An EPA-approved hospital-grade disinfectant. Explanation. EPA-approved disinfectants are effective against a broad range of pathogens, including multi-drug-resistant organisms. 20. What action should be taken if a healthcare worker accidentally pricks themselves with a contaminated needle? Answer. Wash the wound thoroughly with soap and water and report the incident. Explanation. Immediate cleaning of the wound with soap and water helps reduce the risk of infection, and the incident must be reported for further evaluation and management. 21. When should a nurse perform hand hygiene? Answer. Before and after patient contact, after handling contaminated materials, and before eating. Explanation. Hand hygiene is critical in preventing the spread of infections, and it should be performed at key times to maintain a clean environment. 22. What is the most important factor in preventing surgical site infections? Answer. Proper aseptic technique during the surgical procedure. Explanation. Using aseptic technique during surgery reduces the introduction of pathogens into the sterile field, preventing infections at the surgical site. 23. A nurse notices that a patient's wound dressing is wet and contains drainage. What should be done next? Answer. Change the wound dressing and wear gloves. Explanation. Changing the wound dressing ensures that the wound is properly managed and that the nurse is protected from potential contamination by wearing gloves. 24. What should a nurse do before entering the room of a patient on contact precautions? Answer. Don gloves and gown. Explanation. Contact precautions require the use of gloves and a gown to prevent contamination from direct or indirect contact with the patient or their environment. 25. Which of the following is a key component of infection prevention in neonatal intensive care units, NICU? Answer. Strict adherence to hand hygiene and sterile techniques. Explanation. Neonates have weaker immune systems, so strict hand hygiene and sterile techniques are crucial to prevent the spread of infections in the NICU. 26. How often should alcohol-based hand sanitizers be used in patient care? Answer. When soap and water are not available and hands are not visibly soiled. Explanation. Alcohol-based hand sanitizers are effective at reducing pathogen transmission but should not be used if hands are visibly dirty, where soap and water are more effective. 27. Which of the following is the primary mode of transmission for the flu virus? Answer. Droplet transmission. Explanation. The flu virus spreads through respiratory droplets when an infected person coughs or sneezes, making droplet precautions necessary. 28. What type of precaution should be used for a patient with an infection that is spread through airborne transmission? Answer. Airborne precautions. Explanation. Airborne precautions, including the use of an N95 respirator, are required to prevent the inhalation of small particles carrying pathogens. 29. How should a nurse handle a contaminated needle used for an injection? Answer. Place it in a puncture-resistant sharps container. Explanation. Used needles should never be recapped or discarded improperly. They must be disposed of in a puncture-resistant sharps container to prevent injury and infection. 30. A patient in the hospital has a multi-drug-resistant infection. What is the most important infection control strategy? Answer. Isolation and strict adherence to contact precautions. Explanation. Isolation prevents the spread of multi-drug-resistant infections, and contact precautions limit exposure to the patient's body fluids and environment. 31. A nurse observes a colleague not wearing gloves while handling soiled linen. What should the nurse do? Answer: remind the colleague to wear gloves for safety. Explanation: wearing gloves when handling soiled linen is critical to avoid direct contact with pathogens, which can lead to healthcare-associated infections. 32. Which personal protective equipment is required for caring for a patient with a cough and fever who is suspected of having COVID-19? Answer: surgical mask, gloves, and gown. Explanation: a surgical mask helps prevent the spread of respiratory droplets, and gloves and gowns protect against contact with infectious materials. 33. A nurse is caring for a patient who is under droplet precautions. Which of the following should be done before entering the room? Answer: wear a surgical mask. Explanation: droplet precautions require wearing a surgical mask to prevent the transmission of infectious droplets that can travel short distances through the air. 34. What is the most effective method for preventing the transmission of infectious diseases in a healthcare facility? Answer: implementing standard precautions. Explanation: standard precautions, including hand hygiene and proper use of PPE, reduce the spread of infections across all patient care settings. 35. What action should a nurse take if there is a spill of a body fluid in a patient's room? Answer: wear gloves and follow the facility's spill protocol for cleaning. Explanation: following proper protocols for cleaning spills helps contain the potential spread of pathogens while ensuring that the nurse is protected from exposure. 36. A nurse is preparing to give an injection to a patient. What should the nurse do first? Answer: perform hand hygiene. Explanation: performing hand hygiene before administering any medication is a fundamental step in preventing the spread of infection. 37. When should a healthcare worker change gloves during patient care? Answer: after touching potentially contaminated surfaces or after each patient interaction. Explanation: gloves should be changed regularly to avoid cross-contamination and to maintain patient safety during care. 38. What is the primary goal of contact precautions? Answer: to prevent the spread of infections that are transmitted by direct or indirect contact. Explanation: contact precautions help to limit the exposure to infectious agents by ensuring that protective measures, such as gloves and gowns, are worn when interacting with infected patients. 39. Which of the following is the most effective cleaning agent for surfaces contaminated with Clostridium difficile spores? Answer: a bleach-based disinfectant. Explanation: a bleach-based disinfectant is effective at killing C. difficile spores, which are resistant to many other cleaning agents. 40. A nurse is caring for a patient who has been diagnosed with a viral infection requiring isolation precautions. Which of the following should the nurse do first? Answer: don the appropriate PPE, including a mask. Explanation: donning the appropriate PPE, including a mask, helps to protect the nurse from exposure to viral particles and prevents the spread of infection to others. 41. A nurse is changing the dressing on a patient's surgical wound. What is the most important action to prevent infection? Answer: perform hand hygiene before and after changing the dressing. Explanation: hand hygiene before and after dressing changes is essential to prevent the introduction of pathogens into the surgical wound. 42. What type of precaution should be implemented for a patient with an antibiotic-resistant infection? Answer: contact precautions. Explanation: antibiotic-resistant infections can spread through direct or indirect contact, making contact precautions essential to reduce the risk of transmission. 43. A patient has a surgical wound with a large amount of drainage. What should the nurse do next? Answer: apply a sterile dressing. Explanation: a sterile dressing is necessary to protect the wound from contamination and to absorb excess drainage, reducing the risk of infection. 44. What is the most important infection control measure in preventing healthcare-associated urinary tract infections? Answer: proper catheter care. Explanation: proper catheter care, including hand hygiene and maintaining a closed system, is crucial in preventing urinary tract infections related to catheter use. 45. A nurse notices a colleague not following infection control procedures. What is the appropriate action? Answer: report the behavior to a supervisor. Explanation: Failure to follow infection control procedures compromises patient safety, and reporting the behavior ensures corrective actions are taken. 46. A patient is admitted with a known infection caused by a multi-drug-resistant organism. What type of isolation is most appropriate? Answer: contact isolation. Explanation: contact isolation is required for multi-drug-resistant organisms to prevent the transmission of resistant bacteria. 47. A nurse is caring for a patient with a compromised immune system. Which of the following infection control measures is most important? Answer: use strict aseptic technique. Explanation: aseptic technique minimizes the risk of introducing pathogens to patients with weakened immune systems, protecting them from potential infections. 48. What is the most appropriate way to clean a surface that has been contaminated with bodily fluids? Answer: use a hospital-grade disinfectant. Explanation: hospital-grade disinfectants are effective against a wide range of pathogens, including those that may be present in bodily fluids. 49. When should a nurse perform a surgical hand scrub? Answer: before performing a surgical procedure. Explanation: a surgical hand scrub is done to ensure that the hands are free of pathogens before performing any sterile procedure. 50. A nurse is caring for a patient on contact precautions. What PPE should the nurse wear when entering the room? Answer: gloves and gown. Explanation: contact precautions require the nurse to wear gloves and a gown to prevent contamination from the patient's body fluids or environment. 51. What should a nurse do if a patient is suspected of having a highly contagious infection? Answer: place the patient on isolation precautions. Explanation: isolation precautions, including appropriate PPE and room isolation, are essential to prevent the spread of highly contagious infections. 52. What is the primary reason for using personal protective equipment, PPE, in healthcare? Answer: to protect both healthcare workers and patients from infection. Explanation: PPE acts as a barrier to prevent the transmission of infectious agents between healthcare workers and patients. 53. How often should surfaces in patient rooms be cleaned in a hospital setting? Answer: at least daily and whenever visibly soiled. Explanation: surfaces should be cleaned regularly to prevent the accumulation of pathogens that could potentially be transferred to patients or healthcare workers. 54. What is the most effective method for preventing the spread of gastrointestinal infections? Answer: frequent hand hygiene and isolation of infected patients. Explanation: proper hand hygiene and isolating infected patients help reduce the transmission of gastrointestinal pathogens. 55. Which action is most important for a nurse to take when caring for a patient with a respiratory infection? Answer: wear a surgical mask when within 3 feet of the patient. Explanation: respiratory infections are transmitted through droplets, so wearing a surgical mask helps prevent their spread. 56. Which of the following actions is the nurse's priority when caring for a patient in contact isolation? Answer: donning gloves and a gown before entering the room. Explanation: contact isolation requires wearing appropriate PPE to protect against contamination from infected surfaces or bodily fluids. 57. A nurse is preparing to remove a contaminated gown. What is the proper order for removing PPE? Answer: gloves first, then gown. Explanation: gloves should be removed first to avoid contaminating the gown, and the gown should be removed carefully to avoid touching the outside of it. 58. What should be done if a nurse accidentally gets a blood splash in their eye? Answer: rinse the eye with water and report the incident. Explanation: immediate rinsing of the eye with water minimizes the risk of infection, and the incident must be reported for follow-up care. 59. What is the primary reason for using alcohol-based hand sanitizer in healthcare settings? Answer: to reduce the number of pathogens on hands when soap and water are not available. Explanation: alcohol-based hand sanitizers are effective in reducing microbial load on hands, especially when soap and water are unavailable. 60. When caring for a patient with a draining wound, which precaution should the nurse follow? Answer: use a face shield or goggles to protect from splashes. Explanation: Protecting the eyes and face from splashes ensures the nurse does not come into contact with potentially infectious materials. 61. Which of the following is the best method for preventing the spread of influenza in a healthcare setting? Answer: administering the flu vaccine to staff and patients. Explanation: the flu vaccine helps prevent influenza outbreaks by reducing the spread of the virus in healthcare settings. 62. What should a nurse do when preparing to administer an injection to a patient with an infection? Answer: cleanse the site with an alcohol swab. Explanation: cleansing the injection site with an alcohol swab helps reduce the risk of introducing additional bacteria into the skin during the injection. 63. What type of personal protective equipment should be worn when caring for a patient with pneumonia? Answer: surgical mask, gloves, and gown. Explanation: a surgical mask helps prevent droplet transmission, and gloves and a gown protect against contact with secretions and body fluids. 64. A nurse is entering a room of a patient on airborne precautions. What PPE is required? Answer: N95 respirator, gloves, and gown. Explanation: airborne precautions require an N95 respirator to filter out small particles, along with gloves and gown for additional protection. 65. A nurse is caring for a patient with an active infection and is required to wear a gown. What should the nurse do after leaving the patient's room? Answer: remove the gown and gloves before exiting the room. Explanation: removing PPE before exiting the room helps prevent cross-contamination of the environment. 66. What is the most effective way to prevent healthcare-associated infections, HAIs, in the operating room? Answer: adhering to strict aseptic techniques during surgery. Explanation: aseptic techniques in the operating room minimize the introduction of infectious agents, preventing surgical site infections. 67. Which of the following is the most appropriate method for preventing the transmission of methicillin-resistant Staphylococcus aureus, MRSA? Answer: implementing contact precautions for affected patients. Explanation: MRSA spreads through direct contact, and contact precautions are necessary to prevent its transmission. 68. What is the first step in caring for a patient who has been exposed to a bloodborne pathogen? Answer: wash the exposed area with soap and water. Explanation: immediate washing with soap and water helps reduce the risk of infection after exposure to bloodborne pathogens. 69. What is the purpose of performing a surgical scrub before surgery? Answer: to reduce the number of microorganisms on the hands. Explanation: a surgical scrub is performed to reduce the microbial load on the hands and arms before performing a sterile procedure. 70. A nurse notices a red, swollen area on a patient's leg that is warm to the touch. What action should the nurse take? Answer: notify the physician and implement infection control measures. Explanation: a red, swollen area may indicate an infection, and timely intervention is necessary to prevent further spread. 71. A patient is placed on isolation due to a respiratory infection. What PPE should be used when entering the room? Answer: a surgical mask, gloves, and gown. Explanation: PPE, including a surgical mask and gloves, is required to protect against droplets and direct contact with respiratory secretions. 72. Which of the following is the most effective method for reducing the spread of infection when using a urinary catheter? Answer: follow proper sterile techniques during insertion and maintenance. Explanation: using sterile techniques during insertion and maintenance helps reduce the risk of catheter-associated urinary tract infections. 73. How often should a nurse wash their hands while caring for a patient with a contagious infection? Answer: before and after every patient interaction and after touching potentially contaminated surfaces. Explanation: frequent hand washing reduces the transmission of pathogens between patient interactions. 74. What is the primary method of infection prevention in a neonatal intensive care unit, NICU? Answer: strict adherence to hand hygiene and isolation precautions. Explanation: hand hygiene and isolation precautions help protect vulnerable neonates from infections in the NICU. 75. What type of precautions should be followed when caring for a patient with a known gastrointestinal infection? Answer: contact precautions. Explanation: Contact precautions are necessary to prevent the spread of gastrointestinal pathogens through direct or indirect contact. 76. A nurse is preparing to care for a patient with an infection requiring droplet precautions. What PPE should be worn? Answer: surgical mask and gloves. Explanation: droplet precautions require a surgical mask to prevent respiratory droplets from reaching the healthcare worker, along with gloves for protection against contact. 77. What is the primary reason for isolating a patient with a contagious infection? Answer: to prevent the spread of the infection to other patients and healthcare workers. Explanation: isolation prevents infectious agents from spreading to others, reducing the risk of outbreaks in healthcare settings. 78. What should a nurse do if a patient on isolation precautions requests a visit from a family member? Answer: ensure the family member wears appropriate PPE and follows infection control protocols. Explanation: family members must adhere to the same infection control precautions as healthcare workers to avoid transmitting infection. 79. Which of the following should be done if a nurse is exposed to a patient's respiratory droplets? Answer: perform hand hygiene and monitor for symptoms. Explanation: hand hygiene helps reduce the risk of contamination, and monitoring for symptoms allows for timely intervention if an infection develops. 80. A patient with a contagious infection is being discharged from the hospital. What should the nurse ensure before discharge? Answer: provide instructions on how to prevent the spread of infection at home. Explanation: educating patients on proper hygiene and isolation practices at home helps reduce the risk of spreading the infection to family members and others. 81. What action should a nurse take if a contaminated needle is found in a patient's room? Answer: immediately place the needle in a sharps container. Explanation: contaminated needles should be disposed of in a sharps container to prevent needle stick injuries and transmission of infections. 82. Which of the following is the most important action to prevent the spread of infection in a hospital setting? Answer: hand hygiene. Explanation: hand hygiene is the most effective method to reduce the transmission of infections in healthcare environments. 83. What is the most important action when caring for a patient with an active wound infection? Answer: use sterile technique when changing the dressing. Explanation: using sterile techniques when handling wound dressings helps prevent further contamination of the wound and reduces the risk of infection. 84. How should a nurse dispose of gloves after caring for a patient with a contagious infection? Answer: remove the gloves carefully and dispose of them in a designated waste container. Explanation: proper disposal of gloves helps reduce the risk of contamination and the spread of infectious agents. 85. What infection control practice should be followed when caring for a patient with an upper respiratory infection? Answer: place the patient in a private room with droplet precautions. Explanation: droplet precautions are necessary to prevent the spread of respiratory infections, including the use of a private room. 86. What is the purpose of wearing a face shield or goggles when caring for a patient with a contagious infection? Answer: to protect the eyes and face from splashes or droplets. Explanation: eye protection prevents droplets from entering the mucous membranes of the eyes and face, reducing the risk of infection. 87. What should be done if a nurse has a cut or open wound while caring for a patient with an infection? Answer: cover the wound with a waterproof bandage before providing care. Explanation: covering the wound with a waterproof bandage helps prevent exposure to pathogens while providing patient care. 88. What is the most effective infection control measure for preventing surgical site infections? Answer: administer prophylactic antibiotics as prescribed before surgery. Explanation: prophylactic antibiotics reduce the risk of bacterial infections after surgery, particularly in high-risk patients. 89. What is the best action to take when a nurse is about to perform a procedure on a patient with an active infection? Answer: ensure that the correct PPE is worn to prevent exposure to infectious agents. Explanation: wearing appropriate PPE is essential to prevent healthcare workers from being exposed to infectious agents during procedures. 90. When should a nurse use a surgical mask for infection control? Answer: when caring for a patient with a respiratory infection. Explanation: A surgical mask helps prevent the spread of respiratory droplets from the patient to the healthcare worker or environment. 91. A nurse notices that a patient's wound is draining a yellowish, foul-smelling fluid. What is the nurse's first action? Answer: report the wound drainage to the physician immediately. Explanation: a change in wound drainage, especially when it has a foul smell, may indicate infection and requires immediate medical assessment and intervention. 92. Which of the following is most important when caring for a patient with tuberculosis? Answer: wearing a fit-tested N95 respirator mask. Explanation: tuberculosis is transmitted via airborne droplets, so an N95 respirator is necessary to filter out small infectious particles. 93. A patient on isolation precautions requires a transport to another department. What should the nurse do? Answer: ensure the patient wears a mask and follow the isolation protocol during transport. Explanation: the patient should wear a mask to prevent droplet transmission, and isolation protocols must be adhered to for safe transport. 94. When removing gloves after patient care, what is the nurse's most important step? Answer: perform hand hygiene immediately after removing gloves. Explanation: hand hygiene is essential to remove any potential pathogens that may have been transferred to the hands from the outside of the gloves. 95. Which of the following should be done before preparing a sterile field for a procedure? Answer: perform hand hygiene. Explanation: hand hygiene is essential before setting up a sterile field to reduce the risk of contaminating the sterile environment. 96. What should a nurse do if they are exposed to a needle stick injury while caring for a patient with a known infection? Answer: immediately clean the wound with soap and water and report the incident. Explanation: prompt cleaning and reporting are crucial to minimize the risk of infection transmission from a needle stick injury. 97. A nurse is caring for a patient who has C. difficile. What type of precautions should be implemented? Answer: contact precautions. Explanation: C. difficile is spread via spores through direct or indirect contact, requiring the use of contact precautions to prevent transmission. 98. What is the primary purpose of using a dedicated equipment, e.g., thermometer, for each patient in isolation? Answer: to prevent cross-contamination between patients. Explanation: using dedicated equipment for each patient helps prevent the transmission of pathogens that may be present on the equipment. 99. What is the best way to prevent the spread of infection in a hospital room with a patient who has an open wound? Answer: maintain sterile technique when dressing the wound. Explanation: sterile technique minimizes the risk of introducing additional pathogens into an open wound, reducing the risk of infection. 100. What should a nurse do when they are about to administer medications to a patient in isolation? Answer: wear gloves and follow isolation protocols for the patient's condition. Explanation: wearing gloves and adhering to isolation protocols help prevent the transmission of infection during medication administration. 101. When performing a sterile dressing change, what is the nurse's priority action? Answer: open the sterile supplies using sterile technique. Explanation: sterile technique must be used to avoid contaminating the supplies and the dressing, reducing the risk of infection. 102. Which of the following is a priority for preventing the spread of respiratory infections in a hospital setting? Answer: implement droplet precautions for symptomatic patients. Explanation: droplet precautions prevent respiratory pathogens from being transmitted through droplets when a patient coughs or sneezes. 103. What should a nurse do to prevent infection transmission when caring for a patient with a gastrointestinal infection? Answer: implement contact precautions and perform hand hygiene frequently. Explanation: contact precautions and frequent hand hygiene reduce the risk of transmission of gastrointestinal pathogens. 104. What is the most important action when handling linens from a patient with a contagious infection? Answer: place the linens in a designated, labeled laundry bag. Explanation: using a designated laundry bag helps contain and prevent the spread of infectious material from the linens. 105. What should a nurse do if a patient on isolation precautions needs to use the restroom? Answer: assist the patient in wearing a mask and ensure proper hygiene is followed. Explanation: masking the patient, and ensuring hygiene reduces the risk of spreading infectious agents outside the isolation room. 106. Which of the following actions should be taken when cleaning a hospital room after a patient with a contagious infection has been discharged? Answer: perform terminal cleaning of the room using a disinfectant. Explanation: terminal cleaning with an effective disinfectant kills pathogens that may be left on surfaces after the patient leaves the room. 107. How often should an N95 respirator mask be replaced? Answer: when it becomes soiled, damaged, or difficult to breathe through. Explanation: an N95 mask must be replaced to maintain its efficacy in filtering airborne particles and to avoid exposure to infectious agents. 108. A patient with a urinary tract infection, UTI, requires catheterization. What infection control measure is most important? Answer: use sterile technique during catheter insertion. Explanation: sterile technique is critical to avoid introducing pathogens into the urinary tract during catheter insertion, reducing the risk of a healthcare-associated UTI. 109. What action should a nurse take if they suspect a patient is developing a healthcare-associated infection, HAI? Answer: notify the healthcare provider and initiate appropriate infection control precautions. Explanation: early identification and timely intervention help prevent the spread of HAIs and reduce the risk of complications for the patient. 110. What should a nurse do if they suspect an outbreak of influenza on the unit? Answer: implement droplet precautions and notify the infection control department. Explanation: droplet precautions are necessary to prevent the spread of influenza, and notifying infection control ensures that appropriate measures are taken. 111. When should a healthcare worker wear gloves when interacting with a patient? Answer: when there is a potential for contact with blood, body fluids, or contaminated surfaces. Explanation: gloves provide a barrier to protect healthcare workers from potential exposure to infectious agents. 112. What is the most effective way to prevent the spread of infection in a healthcare setting? Answer: consistently perform hand hygiene. Explanation: hand hygiene is the most effective intervention to prevent the transmission of infections in healthcare settings. 113. What is the priority action when preparing to care for a patient with a known infectious disease? Answer: review and follow the infection control protocols for the specific disease. Explanation: disease-specific infection control protocols are designed to minimize the risk of transmission and protect both patients and healthcare workers. 114. Which of the following is a necessary infection control measure when providing wound care for a patient with a draining abscess? Answer: use a sterile dressing and clean the wound with aseptic technique. Explanation: using sterile and aseptic techniques reduces the risk of introducing additional pathogens into the wound. 115. What should a nurse do if a patient is suspected of having an airborne transmitted disease, such as tuberculosis? Answer: place the patient in a negative pressure isolation room. Explanation: a negative pressure room helps prevent the spread of airborne pathogens by keeping air from escaping the room. 116. What should a nurse do if they witness another healthcare worker not following infection control protocols? Answer: address the issue immediately and report it to the supervisor. Explanation: reporting and addressing infection control breaches ensures patient safety and promotes adherence to safety standards. 117. Which of the following is the most important practice to prevent the transmission of Clostridium difficile, C. difficile? Answer: washing hands with soap and water after caring for an infected patient. Explanation: alcohol-based hand sanitizers are not effective against C. difficile spores, so soap and water are necessary for effective hand hygiene. 118. A nurse is caring for a patient with MRSA and a wound. What is the most important infection control practice? Answer: implement contact precautions. Explanation: MRSA is transmitted through direct contact, and contact precautions prevent the spread to other patients or healthcare workers. 119. What should a nurse do to reduce the risk of infection when administering an injection? Answer: clean the injection site with an alcohol swab. Explanation: cleaning the injection site with an alcohol swab helps reduce the risk of introducing pathogens during the injection process. 120. What is the best infection control practice when disposing of a patient's used syringe? Answer: place the syringe in a designated sharps container. Explanation: sharps containers are designed to safely contain needles and syringes, preventing injuries and the transmission of infections. 121. A nurse notices that a patient with an indwelling catheter has developed fever and chills. What should the nurse do first? Answer: assess the catheter site for signs of infection and notify the physician. Explanation: fever and chills can be signs of a urinary tract infection, and early identification of infection helps prevent complications. 122. What is the most effective way to prevent surgical site infections? Answer: administer prophylactic antibiotics as prescribed and maintain a septic technique. Explanation: prophylactic antibiotics help prevent infections, and a septic technique reduces the risk of contamination during surgery. 123. What is the first action when caring for a patient suspected of having a viral infection that is spread via droplets? Answer: implement droplet precautions and notify the healthcare provider. Explanation: droplet precautions, such as wearing a surgical mask, reduce the risk of transmission of the infection through respiratory droplets. 124. A nurse is preparing to enter a patient's room on contact precautions. What PPE should be worn? Answer: gloves and gown. Explanation: contact precautions prevent the spread of infection through direct contact with infected materials, so gloves and a gown are required. 125. What should a nurse do if they are unable to remove a contaminated gown without touching the outside? Answer: have another healthcare worker assist in removing the gown. Explanation: it is important not to touch the outside of a contaminated gown to avoid cross-contamination. A second person may help safely remove it. 126. What is the most important infection control measure when caring for a patient with a respiratory infection? Answer: implement droplet precautions. Explanation: respiratory infections are often spread through droplets when the patient coughs, sneezes, or talks, and droplet precautions prevent transmission. 127. Which of the following should the nurse do first before starting an intravenous line in a patient with a suspected infection? Answer: perform hand hygiene. Explanation: hand hygiene is the most important step in preventing the introduction of pathogens during any procedure, including for insertion. 128. When caring for a patient on airborne precautions, what should a nurse wear? Answer: a fitted N95 respirator mask. Explanation: airborne precautions require an N95 respirator mask to filter out smaller infectious particles that may be airborne. 129. A nurse is performing a dressing change on a wound with purulent drainage. What should the nurse do to maintain infection control? Answer: use sterile technique during the dressing change. Explanation: sterile technique ensures that no additional pathogens are introduced into the wound during the procedure, reducing the risk of infection. 130. What is the first step in infection control when receiving a patient from the emergency department with suspected meningitis? Answer: place the patient in a private room with droplet precautions. Explanation: meningitis can be spread through respiratory droplets, so the patient should be placed in a private room with droplet precautions to prevent transmission. 131. How should a nurse dispose of used disposable gloves after caring for a patient in isolation? Answer: place the gloves in a designated biohazard waste container. Explanation: used gloves should be discarded in a biohazard container to safely dispose of potentially contaminated materials. 132. A nurse is caring for a patient with a Clostridium difficile infection. What should be prioritized when providing care? Answer: practice thorough hand hygiene with soap and water. Explanation: alcohol-based hand sanitizers are ineffective against C. difficile spores, so thorough hand washing with soap and water is essential to prevent the spread of infection. 133. What is the most important action when removing a surgical mask after caring for a patient on droplet precautions? Answer: perform hand hygiene after removing the mask. Explanation: after removing a mask, performing hand hygiene prevents contamination from any pathogens that may be on the mask or hands. 134. A nurse is caring for a patient on isolation precautions for a contagious disease. What should be done to prevent cross-contamination? Answer: ensure dedicated equipment is used for the patient and disinfect equipment between uses. Explanation: dedicated equipment prevents the spread of infection, and disinfecting shared equipment reduces the risk of transmission. 135. Which of the following is an appropriate action when cleaning a surface contaminated by a patient with a gastrointestinal infection? Answer: use a disinfectant that is effective against gastrointestinal pathogens. Explanation: using a disinfectant that is proven to kill specific pathogens, like those causing gastrointestinal infections, ensures proper cleaning and decontamination. 136. What should a nurse do if a sterile dressing becomes contaminated during the dressing change? Answer: discard the contaminated dressing and use a new sterile dressing. Explanation: if the dressing becomes contaminated, it should be discarded immediately and a new sterile dressing should be used to prevent infection. 137. What is the correct procedure for cleaning and disinfecting a contaminated room after a patient with a contagious disease has been discharged? Answer: perform terminal cleaning using an EPA-approved disinfectant. Explanation: terminal cleaning ensures that all surfaces are disinfected thoroughly using a cleaning agent effective against the infectious agent. 138. What is the most important infection control measure when handling body fluids? Answer: always wear gloves and perform hand hygiene after removal. Explanation: gloves provide a protective barrier, and hand hygiene after removing gloves helps prevent the transmission of pathogens. 139. What is the priority infection control measure when handling linens from a patient in isolation? Answer: place the linens in a designated, labeled laundry bag without shaking them. Explanation: placing the linens in a designated bag without shaking them prevents the spread of infectious particles into the air. 140. When should a nurse replace a surgical mask while caring for a patient in droplet precautions? Answer: replace the mask when it becomes moist or damaged. Explanation: a mask that is moist or damaged may not provide adequate protection against pathogens, so it should be replaced promptly. 141. A patient with a fever and respiratory distress is admitted with suspected pneumonia. What infection control precautions should the nurse implement? Answer: implement droplet precautions and monitor for changes in respiratory status. Explanation: pneumonia can be transmitted through respiratory droplets, so droplet precautions are needed to prevent the spread of infection. 142. Which of the following should the nurse do before inserting an indwelling urinary catheter? Answer: perform hand hygiene and use sterile technique. Explanation: hand hygiene and sterile technique are necessary to reduce the risk of introducing pathogens during catheter insertion. 143. What should a nurse do if a patient in contact precautions has an unplanned transfer to another unit? Answer: ensure the patient is wearing a gown and gloves and that the isolation protocol is maintained. Explanation: maintaining isolation protocols during transport ensures that infectious agents do not spread to other areas of the hospital. 144. What should be done to prevent the spread of infection when a patient on isolation precautions needs a procedure done in the hospital? Answer: ensure the procedure area is cleaned and disinfected after the procedure. Explanation: proper cleaning and disinfecting of the procedure area reduces the risk of contamination for other patients and healthcare workers. 145. When caring for a patient with a wound infection, what is the best way to maintain aseptic technique during dressing changes? Answer: use sterile gloves and supplies and avoid touching the wound directly. Explanation: using sterile gloves and supplies and avoiding direct contact with the wound helps prevent contamination and infection. 146. A nurse is assisting a patient with the removal of a urinary catheter. What infection control step is essential? Answer: perform hand hygiene before and after the procedure. Explanation: hand hygiene before and after the procedure reduces the risk of introducing or spreading infection. 147. What is the first action to take when a nurse is exposed to blood during patient care? Answer: wash the affected area with soap and water immediately. Explanation: washing the affected area promptly with soap and water helps minimize the risk of infection transmission after exposure to blood. 148. What is the most effective method for preventing the transmission of influenza in a hospital setting? Answer: implement droplet precautions for symptomatic patients and encourage staff vaccination. Explanation: droplet precautions prevent the transmission of influenza through respiratory droplets, and vaccination reduces the risk of healthcare worker exposure. 149. A nurse is caring for a patient with an indwelling catheter who develops a fever. What is the most appropriate action? Answer: assess for signs of catheter-related infection and notify the healthcare provider. Explanation: a fever may indicate an infection, and early assessment and treatment can prevent further complications. 150. What should be done to prevent the transmission of infection when using patient care equipment, such as thermometers and blood pressure cuffs? Answer: clean and disinfect the equipment after each use. Explanation: cleaning and disinfecting patient care equipment ensures that pathogens are not transferred between patients. 151. What is the best method to prevent the spread of MRSA in a hospital setting? Answer: implement contact precautions and ensure proper hand hygiene. Explanation: MRSA spreads through direct contact, and contact precautions, combined with good hand hygiene, prevent its transmission. 152. A nurse is caring for a patient with a draining wound who has been placed in isolation. What should be done to reduce the risk of infection spread? Answer: use a sterile dressing and change it regularly. Explanation: using sterile dressings helps prevent additional pathogens from entering the wound and spreading. 153. What infection control practice is necessary when disposing of a contaminated dressing? Answer: place the dressing in a biohazard waste container. Explanation: contaminated dressings must be disposed of in a biohazard container to prevent the spread of infectious materials. 154. What should the nurse do before caring for a patient on isolation precautions? Answer: review the patient's specific isolation precautions and wear appropriate personal protective equipment, PPE. Explanation: understanding the required precautions and wearing the appropriate PPE minimizes the risk of transmission of infectious agents. 155. What is the best practice for preventing surgical site infections? Answer: administer prophylactic antibiotics prior to surgery and maintain sterile technique. Explanation: prophylactic antibiotics reduce the risk of infection, and sterile technique ensures no pathogens are introduced during the surgical procedure. 156. What is the primary action when cleaning a patient's room after they have been discharged with a suspected contagious disease? Answer: perform terminal cleaning using an EPA-approved disinfectant. Explanation: terminal cleaning is necessary to thoroughly disinfect all surfaces and prevent the spread of infectious agents. 157. When should a healthcare worker change gloves while providing patient care? Answer: after each patient contact, or if the gloves become soiled or torn. Explanation: changing gloves prevents the transfer of pathogens between patients and reduces the risk of cross-contamination. 158. A patient in isolation for a contagious infection requires an X-ray. What should the nurse do to prevent the spread of infection during transport? Answer: ensure the patient wears a mask and transport them with the appropriate isolation precautions. Explanation: wearing a mask and maintaining isolation precautions during transport reduces the risk of spreading the infection to others. 159. What is the first priority when caring for a patient with a suspected viral infection? Answer: implement appropriate isolation precautions based on the suspected virus. Explanation: isolation precautions are tailored to the mode of transmission of the virus and help prevent its spread to others. 160. A nurse is caring for a patient with a draining wound. What is the best method to prevent infection transmission? Answer: use gloves and a sterile dressing when handling the wound. Explanation: wearing gloves and using a sterile dressing prevents pathogens from being transferred to the wound and reduces the risk of infection transmission. 161. What should a nurse do when caring for a patient who requires a procedure while on contact precautions? Answer: ensure the patient is appropriately covered with a gown and gloves and limit movement outside the room. Explanation: maintaining the integrity of contact precautions ensures that infectious agents do not spread to other areas of the hospital. 162. A patient is diagnosed with tuberculosis. What infection control measure is essential for the nurse to implement? Answer: place the patient in a negative pressure room and use an N95 respirator. Explanation: tuberculosis is airborne, so a negative pressure room and an N95 respirator are necessary to contain the bacteria and prevent its spread. 163. What is the appropriate action if a nurse accidentally pricks themselves with a needle while caring for a patient with HIV? Answer: immediately wash the area with soap and water and report the incident to the healthcare provider. Explanation: promptly washing the affected area and reporting the incident helps prevent potential infection and ensures proper post-exposure care. 164. How should a nurse handle contaminated laundry from a patient on isolation precautions? Answer: place the laundry in a labeled, sealed bag and send it to the designated laundry area. Explanation: contaminated laundry should be handled with care to prevent the spread of pathogens. It should be placed in a sealed bag to avoid airborne transmission. 165. A nurse is caring for a patient who has a urinary tract infection, UTI, and is receiving antibiotics. What is the priority infection control measure? Answer: practice good hand hygiene and ensure the patient is using a clean catch method for urine samples. Explanation: hand hygiene helps prevent cross-contamination, and using a clean catch method for urine samples reduces the risk of contamination during testing. 166. A patient in isolation has a wound with purulent drainage. What infection control measure should the nurse take? Answer: use personal protective equipment, PPE, including gloves and a gown, during dressing changes. Explanation: wearing appropriate PPE ensures that the nurse does not come into contact with infectious material and prevents the spread of infection. 167. What should a nurse do if they observe a visitor not wearing the required PPE while visiting a patient in isolation? Answer: inform the visitor about the isolation precautions and provide the appropriate PPE. Explanation: ensuring that visitors follow proper infection control protocols is essential in preventing the spread of infection. 168. What is the most important infection control action when caring for a patient with a draining wound and suspected MRSA? Answer: implement contact precautions and ensure thorough hand hygiene. Explanation: MRSA is spread through direct contact, and contact precautions, combined with hand hygiene, are essential in preventing its spread. 169. Which of the following is the most effective way to prevent the transmission of infections in a hospital setting? Answer: adhere to standard precautions for all patients, regardless of their diagnosis. Explanation: standard precautions include hand hygiene, use of PPE, and proper disposal of waste, which are effective in preventing the spread of most infections. 170. When caring for a patient on droplet precautions, what personal protective equipment, PPE, should the nurse wear? Answer: a surgical mask, gloves, and a gown. Explanation: droplet precautions require a surgical mask to prevent the spread of respiratory droplets, along with gloves and a gown to protect from contamination. 171. What should the nurse do when a patient with a respiratory infection is admitted to the hospital? Answer: place the patient in a private room and implement droplet precautions. Explanation: respiratory infections are transmitted through droplets, and isolating the patient with droplet precautions helps minimize the risk of transmission to others. 172. What infection control practice should be followed when preparing medications for a patient on contact precautions? Answer: ensure the medications are prepared in the patient's room using dedicated equipment. Explanation: using dedicated equipment and preparing medications in the patient's room ensures that no contamination occurs in other areas. 173. When should a nurse wear gloves when caring for a patient with an indwelling catheter? Answer: wear gloves when performing any procedure that involves contact with the catheter or urinary drainage. Explanation: wearing gloves protects the nurse from potential exposure to pathogens, particularly when handling devices like catheters that are in direct contact with the urinary tract. 174. How should a nurse clean a surface that has been contaminated with blood or body fluids from a patient in isolation? Answer: clean the surface using an EPA-approved disinfectant. Explanation: An EPA-approved disinfectant is effective in killing pathogens, ensuring that surfaces are properly sanitized and preventing cross-contamination. 175. A patient diagnosed with a gastrointestinal infection is placed on contact precautions. What is the nurse's primary responsibility? Answer: ensure that gloves and gowns are worn when entering the patient's room and when handling contaminated items. Explanation: contact precautions prevent the spread of gastrointestinal pathogens, and proper use of PPE is essential for infection control. 176. What is the most important action to take when caring for a patient with a C. difficile infection? Answer: wash hands with soap and water rather than using alcohol-based hand sanitizers. Explanation: C. difficile spores are not effectively removed by alcohol-based hand sanitizers, so thorough hand washing with soap and water is necessary to prevent the spread of infection. 177. What should a nurse do when a patient on contact precautions requires a procedure outside the isolation room? Answer: ensure the patient wears a gown and gloves during transport and that the procedure area is disinfected after the procedure. Explanation: wearing protective gear during transport prevents contamination, and cleaning the procedure area reduces the risk of spreading infection. 178. What is the best way to prevent the spread of influenza in a healthcare setting? Answer: ensure healthcare workers and visitors wear a surgical mask when in close proximity to the patient. Explanation: influenza is transmitted through respiratory droplets, and wearing a surgical mask reduces the risk of transmission. 179. What is the nurse's responsibility when caring for a patient with a known drug-resistant infection? Answer: follow strict contact precautions and ensure proper environmental cleaning. Explanation: drug-resistant infections require stringent infection control measures, including contact precautions and thorough cleaning of patient environments. 180. What is the appropriate infection control measure for a patient with a suspected viral hemorrhagic fever? Answer: implement standard and droplet precautions, as well as contact precautions. Explanation: viral hemorrhagic fever is transmitted through contact with bodily fluids and respiratory droplets, requiring multiple precautions to prevent transmission. 181. A nurse is assisting in the discharge of a patient with a contagious infection. What is the most important instruction for the patient? Answer: practice strict hand hygiene and continue isolation precautions at home. Explanation: continuing isolation precautions and proper hand hygiene are essential to prevent spreading the infection to others after discharge. 182. What is the primary infection control measure when caring for a patient with a surgical wound? Answer: use sterile technique when changing the dressing. Explanation: using sterile technique when changing a surgical dressing minimizes the risk of introducing pathogens into the wound and helps prevent infection. 183. When is it appropriate to use an alcohol-based hand sanitizer? Answer: when hands are not visibly soiled and a quick hand hygiene measure is needed. Explanation: alcohol-based hand sanitizers are effective at killing most pathogens when hands are not visibly soiled. 184. A nurse is caring for a patient with a draining wound who requires a dressing change. What is the most important infection control measure? Answer: perform hand hygiene and use sterile gloves. Explanation: hand hygiene and sterile gloves prevent the introduction of pathogens into the wound during dressing changes. 185. How should a nurse dispose of sharps used during patient care? Answer: place the sharps in a puncture-resistant biohazard container. Explanation: a puncture-resistant biohazard container safely contains sharps and prevents injury or the spread of infection. 186. What should a nurse do to maintain infection control when caring for a patient who is receiving intravenous fluids? Answer: ensure the foresight is properly covered with a sterile dressing and monitor for signs of infection. Explanation: a sterile dressing prevents contamination of the foresight, and monitoring for infection ensures early detection and intervention. 187. What is the primary goal of infection control in a healthcare setting? Answer: to prevent the spread of infectious agents to patients, staff, and visitors. Explanation: infection control aims to break the chain of infection to prevent the transmission of pathogens within the healthcare setting. 188. What should be done before performing a wound dressing change on a patient in isolation? Answer: review the patient's specific isolation precautions and gather the necessary sterile supplies. Explanation: preparing for the procedure with the appropriate precautions and sterile supplies ensures infection control during the dressing change. 189. What is the primary infection control measure when caring for a patient with a catheter-associated urinary tract infection, CAUTI? Answer: follow proper hand hygiene and use sterile technique when handling the catheter. Explanation: hand hygiene and sterile technique reduce the risk of introducing additional pathogens and prevent further infection. 190. When a nurse is caring for a patient on airborne precautions, which type of mask should be worn? Answer: an N95 respirator mask. Explanation: an N95 respirator mask filters airborne particles and is essential when caring for patients with airborne infections like tuberculosis. 191. What is the most important infection control practice when caring for a patient with an antibiotic-resistant infection? Answer: implement contact precautions and ensure diligent hand hygiene. Explanation: antibiotic-resistant infections require strict contact precautions to prevent transmission, and proper hand hygiene is crucial to avoid cross-contamination. 192. What should a nurse do if a patient's wound becomes infected after surgery? Answer: notify the healthcare provider and ensure that the wound is kept clean and covered with a sterile dressing. Explanation: early notification and proper wound care prevent further infection and allow for timely treatment. 193. What is the recommended way to prevent the spread of infection from an indwelling catheter? Answer: keep the catheter and surrounding area clean and dry and monitor for signs of infection. Explanation: proper care and monitoring of the catheter site prevent bacterial colonization and reduce the risk of infection. 194. What is the nurse's role in educating a patient with a contagious infection about infection control at home? Answer: instruct the patient to continue isolation precautions and practice proper hand hygiene. Explanation: educating the patient on isolation precautions and hand hygiene ensures that the patient prevents the spread of infection to others in the household. 195. How should a nurse care for a patient with a draining wound on contact precautions? Answer: use disposable gloves and a sterile dressing to cover the wound. Explanation: proper PPE, including gloves and a sterile dressing, prevents cross-contamination and protects both the patient and healthcare providers. 196. When caring for a patient in isolation, which of the following should a nurse prioritize? Answer: strict adherence to infection control precautions, including proper use of PPE. Explanation: adhering to infection control precautions, including the correct use of personal protective equipment, PPE, helps prevent the spread of infection. 197. A nurse is preparing to care for a patient with a ventilator-associated pneumonia, VAP. Which infection control measure is essential? Answer: perform hand hygiene and wear sterile gloves when handling the ventilator equipment. Explanation: proper hand hygiene and sterile technique reduce the risk of transmitting infection when handling ventilator equipment. 198. What action should a nurse take when a patient is admitted with a suspected influenza infection? Answer: place the patient on droplet precautions and provide a surgical mask if they need to leave their room. Explanation: influenza is transmitted through respiratory droplets, so droplet precautions, including a surgical mask, help prevent its spread. 199. What should be the nurse's first action when caring for a patient with a newly diagnosed infectious disease? Answer: review the patient's isolation precautions and implement them immediately. Explanation: isolation precautions are critical to preventing the spread of infectious diseases and should be implemented as soon as a diagnosis is made. 200. A nurse is caring for a patient on neutropenic precautions. What is the most important infection control measure? Answer: minimize exposure to sick individuals and maintain a clean environment. Explanation: neutropenic precautions are used to protect immunocompromised patients from infections, so reducing exposure to illness and maintaining a clean environment are essential. 201. A patient is diagnosed with hepatitis B. Which infection control practice is necessary for all healthcare providers? Answer: use standard precautions, and ensure proper disposal of contaminated materials. Explanation: hepatitis B is transmitted through blood and body fluids, and standard precautions, including proper disposal of contaminated materials, are necessary to prevent transmission. 202. A nurse observes a visitor who is not wearing a mask while visiting a patient on airborne precautions. What should the nurse do? Answer: inform the visitor about the importance of wearing a mask and provide the appropriate PPE. Explanation: airborne precautions prevent the transmission of pathogens, and ensuring visitors wear appropriate PPE is crucial for maintaining infection control. 203. What infection control precaution should a nurse take when caring for a patient with Clostridium difficile, C. difficile, diarrhea? Answer: perform hand hygiene with soap and water and wear gloves and gown. Explanation: C. difficile spores can survive on surfaces and are resistant to alcohol-based hand sanitizers, so thorough hand washing with soap and water is necessary. 204. A patient requires a dressing change for a surgical wound. What infection control practice should the nurse follow? Answer: use sterile gloves and maintain a sterile field when performing the dressing change. Explanation: sterile technique prevents introducing pathogens into the wound and reduces the risk of infection. 205. A nurse is caring for a patient with a draining abscess. What infection control precaution should be implemented? Answer: implement contact precautions and wear gloves and a gown during patient care. Explanation: abscesses contain infected material, and contact precautions with appropriate PPE help prevent the spread of infection. 206. What is the nurse's role in preventing healthcare-associated infections, HAIs? Answer: follow infection control protocols, including hand hygiene, and educate patients and staff about proper infection prevention techniques. Explanation: prevention of HAIs relies on consistent adherence to infection control protocols, including education and hand hygiene. 207. What should a nurse do if a patient in isolation requests to leave their room for an appointment? Answer: ensure the patient wears appropriate PPE and arrange for safe transportation. Explanation: when patients in isolation need to leave their rooms, wearing proper PPE minimizes the risk of spreading infection to other areas. 208. How should a nurse clean hands after providing care to a patient with MRSA? Answer: wash hands thoroughly with soap and water. Explanation: MRSA can be spread through contact, and washing hands with soap and water effectively removes bacteria from the hands. 209. A patient on droplet precautions needs to undergo a procedure in the operating room. What should be the nurse's priority action? Answer: ensure the patient wears a surgical mask during transport and while outside their room. Explanation: droplet precautions require a surgical mask to prevent the transmission of respiratory droplets. 210. A nurse is assisting a patient with a urinary catheter in place. What is the most important infection control measure? Answer: perform hand hygiene before and after handling the catheter and use aseptic technique. Explanation: hand hygiene and aseptic technique reduce the risk of introducing pathogens into the urinary tract, preventing catheter-associated urinary tract infections, CAUTIs. 211. A nurse is caring for a patient with a compromised immune system. Which infection control measure is most important? Answer: minimize exposure to individuals with respiratory infections and practice strict hand hygiene. Explanation: immunocompromised patients are at higher risk for infections, so minimizing exposure to ill individuals and ensuring thorough hand hygiene are critical. 212. What should a nurse do when disposing of contaminated items from a patient with a gastrointestinal infection? Answer: place the contaminated items in a designated biohazard bag for proper disposal. Explanation: contaminated items should be disposed of in biohazard bags to prevent the spread of infectious material to other areas. 213. What personal protective equipment should a nurse wear when caring for a patient with chickenpox? Answer: wear an N95 respirator, gloves, and gown. Explanation: chickenpox is transmitted via airborne droplets, and an N95 respirator, along with gloves and a gown, are necessary for protection. 214. A nurse is providing care for a patient diagnosed with pertussis. What infection control practice is needed? Answer: Implement droplet precautions, including the use of a surgical mask for the nurse and the patient. Explanation: pertussis is spread through respiratory droplets, and droplet precautions help prevent transmission. 215. What is the priority infection control practice when caring for a patient on reverse isolation? Answer: limit visitors and ensure that healthcare workers are free of any infectious conditions. Explanation: reverse isolation is used to protect immunocompromised patients, so minimizing potential exposure to infection is essential. 216. A patient who is post-surgical is exhibiting signs of a wound infection. What is the priority infection control action? Answer: clean the wound with an antiseptic solution, apply a sterile dressing, and perform hand hygiene. Explanation: cleaning the wound reduces the risk of further contamination, and using a sterile dressing helps protect the wound from outside pathogens. 217. What action should be taken when a nurse notices a patient's personal belongings are contaminated with body fluids? Answer: place the contaminated belongings in a biohazard bag for proper disposal or cleaning. Explanation: contaminated belongings should be contained to prevent the spread of infectious material and cleaned or disposed of accordingly. 218. What is the most effective method for preventing the transmission of infectious diseases in a hospital setting? Answer: adhering to standard precautions and practicing good hand hygiene. Explanation: standard precautions, including hand hygiene, reduce the transmission of most pathogens and are the most effective infection control method. 219. What should a nurse do when cleaning a surface that has been contaminated with blood and body fluids from a patient in isolation? Answer: clean the surface using an EPA-approved disinfectant. Explanation: an EPA-approved disinfectant is effective in killing pathogens, ensuring that surfaces are properly sanitized and preventing cross-contamination. 220. What is the most important infection control measure when caring for a patient with a draining wound and suspected MRSA? Answer: implement contact precautions, including wearing gloves and gown. Explanation: MRSA is spread through contact, and contact precautions are necessary to prevent the infection from spreading to other patients or healthcare providers. 221. How should a nurse dispose of a contaminated needle after giving an injection to a patient in isolation? Answer: place the needle in a puncture-resistant, labeled sharps container. Explanation: proper disposal of needles in a puncture-resistant container prevents needle stick injuries and contamination. 222. What is the most appropriate action when a nurse encounters a visitor who has not followed isolation precautions? Answer: educate the visitor about the importance of following isolation precautions and provide the necessary PPE. Explanation: visitors must follow infection control measures to prevent the spread of infection, and education ensures compliance with precautions. 223. A nurse is caring for a patient with a wound infection. What is the most important infection control measure during dressing changes? Answer: use sterile gloves and maintain a sterile field during the dressing change. Explanation: maintaining sterility during dressing changes reduces the risk of introducing new pathogens into the wound and prevents further infection. 224. What should a nurse do if a patient with an indwelling catheter develops signs of a urinary tract infection, UTI? Answer: notify the healthcare provider and follow the appropriate protocols for catheter care. Explanation: prompt identification and treatment of UTIs, including proper catheter care, prevent further complications and spread of infection. 225. When caring for a patient on isolation precautions, what is the nurse's responsibility? Answer: adhere to the specific precautions required for the patient's condition and ensure the appropriate PPE is used. Explanation: adhering to isolation precautions for the patient's specific condition is essential to prevent cross-contamination and protect healthcare workers. 226. What is the primary infection control practice when caring for a patient with Clostridium difficile, C. difficile, infection? Answer: perform hand hygiene with soap and water, and wear gloves and gown. Explanation: C. difficile spores are resistant to alcohol-based hand sanitizers, so washing hands with soap and water is essential for effective hand hygiene. 227. How should the nurse respond if a patient in isolation requires emergency care? Answer: Ensure that appropriate PPE is worn and limit the patient's exposure to others. Explanation: wearing the correct PPE and limiting exposure ensures that the infection does not spread to others in the emergency setting. 228. What infection control measures are necessary for a patient diagnosed with viral meningitis? Answer: implement droplet precautions and ensure that the patient wears a mask if they need to leave their room. Explanation: viral meningitis can be transmitted through respiratory droplets, requiring droplet precautions to prevent its spread. 229. What action should the nurse take when caring for a patient who is undergoing chemotherapy and has a low white blood cell count? Answer: implement reverse isolation precautions to protect the patient from infection. Explanation: reverse isolation is crucial for patients with low white blood cell counts, as it protects them from exposure to pathogens. 230. What is the nurse's role in preventing the spread of infections during a patient's discharge? Answer: provide discharge instructions regarding infection control measures, including wound care and follow-up appointments. Explanation: proper discharge instructions ensure that the patient continues infection control practices at home and reduces the risk of reinfection or spreading the infection. 231. When a nurse is caring for a patient with a surgical wound, what is the best way to prevent infection during dressing changes? Answer: use sterile technique when changing the dressing. Explanation: sterile technique prevents contamination of the wound and reduces the risk of infection during dressing changes. 232. What is the most important infection control measure when caring for a patient on contact precautions for scabies? Answer: wear gloves and a gown, and avoid sharing personal items between patients. Explanation: scabies is transmitted through direct contact, and proper PPE and hygiene help prevent the spread of the infection. 233. A nurse is caring for a patient with tuberculosis, TB. What is the most important infection control practice? Answer: place the patient in a negative pressure room and ensure the nurse wears an N95 respirator. Explanation: TB is airborne, so a negative pressure room and the use of an N95 respirator are necessary to prevent transmission. 234. What is the most effective way to prevent the spread of methicillin-resistant Staphylococcus aureus, MRSA? Answer: implement contact precautions and practice thorough hand hygiene. Explanation: contact precautions and proper hand hygiene are critical in preventing the spread of MRSA in healthcare settings. 235. A patient with an open wound is admitted to the hospital. What infection control measure should the nurse prioritize? Answer: use sterile technique when performing any procedure involving the wound. Explanation: sterile technique minimizes the risk of introducing pathogens into the wound, preventing infection. 236. When caring for a patient with a respiratory infection, what infection control measure should the nurse implement? Answer: use a surgical mask on the patient and wear personal protective equipment, PPE. Explanation: wearing a surgical mask and PPE helps prevent the spread of respiratory infections to others. 237. What should a nurse do if a patient's personal items are soiled with fecal matter? Answer: place the soiled items in a designated laundry bag and follow infection control protocols. Explanation: proper containment of contaminated items prevents the spread of infection to other areas. 238. How should the nurse dispose of contaminated personal protective equipment, PPE, after use? Answer: dispose of used PPE in the appropriate biohazard waste container. Explanation: proper disposal of PPE in biohazard waste containers prevents contamination of the environment and protects others from exposure. 239. What is the nurse's priority action when caring for a patient with a suspected viral hemorrhagic fever, VHF? Answer: implement strict isolation precautions, including contact and droplet precautions. Explanation: VHF is highly contagious and can be transmitted by direct contact with body fluids, so strict isolation precautions are necessary. 240. What is the priority intervention for a patient with an indwelling central line? Answer: implement aseptic technique when caring for the line and perform frequent assessments. Explanation: aseptic technique prevents infection at the insertion site and reduces the risk of central line-associated bloodstream infections, CLABSI. 241. What is the most important step in preventing catheter-associated urinary tract infections, CAUTI? Answer: perform proper hand hygiene before and after handling the catheter. Explanation: hand hygiene is essential to prevent the transfer of pathogens and reduce the risk of CAUTIs. 242. When caring for a patient with Clostridium difficile (C. diff) infection, which precautions should be implemented? Answer: use contact precautions and ensure thorough cleaning of the environment. Explanation: C. diff is spread through direct contact, so contact precautions and thorough cleaning are crucial to prevent transmission. 243. What should a nurse do if a patient develops an infection after surgery? Answer: notify the healthcare provider and follow infection control protocols for wound care. Explanation: promptly notifying the healthcare provider allows for timely intervention, and following infection control protocols ensures proper wound management. 244. What is the most important practice when administering injections to prevent infection? Answer: use a new, sterile needle and syringe for each injection. Explanation: using sterile equipment prevents the introduction of pathogens into the body, reducing the risk of infection. 245. What action should the nurse take if a patient's incision shows signs of infection? Answer: assess the wound, document findings, and report to the healthcare provider. Explanation: early identification of infection allows for timely treatment and helps prevent complications. 246. What infection control measure is necessary when handling blood or body fluids? Answer: always wear appropriate personal protective equipment, PPE. Explanation: PPE protects the nurse from potential exposure to infectious materials and helps prevent the spread of infection. 247. What is the most effective way to prevent surgical site infections? Answer: administer prophylactic antibiotics as ordered and use sterile technique during surgery. Explanation: prophylactic antibiotics and sterile technique are essential in preventing infections during surgery. 248. What should the nurse do if a patient has a positive culture for a resistant organism, such as vancomycin-resistant enterococci, VRE? Answer: implement contact precautions and inform the healthcare team of the infection. Explanation: contact precautions are necessary to prevent the spread of resistant organisms, and informing the healthcare team ensures appropriate management. 249. How should the nurse handle a patient who is immunocompromised and has a fever? Answer: immediately assess for signs of infection and notify the healthcare provider. Explanation: immunocompromised patients are at higher risk for infection, and prompt assessment and reporting ensure timely intervention. 250. What is the most important infection control measure when caring for a patient with a draining wound? Answer: use sterile technique and wear gloves when handling the wound. Explanation: sterile technique and gloves help prevent the introduction of pathogens and reduce the risk of infection.